Hi everyone, Dr. Donovan here. I just wanted to bring you up to date on our Evidence-Based Hair Fellowship Training Program. We are now at week 48 of our 87-week program, and our fellows have just completed their Block 2 exam. Block 2 consisted of some in-depth study of androgenetic alopecia, telogen effluvium, and alopecia areata. In androgenetic alopecia, we looked at, of course, the diagnosis and treatment of all different forms of androgenetic alopecia. In males, we talked about the classic presentations as well as atypical presentations like DUPA and the female pattern of male balding. We talked about acquired progressive kinking of the hair. And certainly if you use the Hamilton-Norwood scale to guide you with male balding, you'll miss a lot of these atypical forms. We talked about female pattern hair loss and how it differs from male balding. Female pattern hair loss is not so much DHT driven, complex condition and different from androgenetic alopecia in males, at least somewhat. Greater role perhaps for the adrenal gland and different mechanisms governing female pattern hair loss. We talked about treatment. We talked about an algorithm and a first line, second line, and third line approach to AGA in males and females. We talked about the wonderful 2019 S3 guidelines published in the JEADV, a wonderful manuscript which reminds us that a lot of treatments for AGA are wonderful and well researched, but wow, a lot of them are poorly researched, poorly understood, and used around the world with very little evidence. And so we talked a lot about the S3 guidelines. We talked about AGA in children and adolescents. Yes, children can develop AGA as well, as young as 5 years of age. We talked about an approach to treating AGA in children and adolescents. We talked about comorbidities with AGA, the metabolic syndrome that goes along with AGA, the prostate cancer and colon cancer risk that some males with AGA may have, and of course the comorbidities of psychosocial issues that arise and the anxiety and depression that hair loss can cause. We moved on to telogen effluvium, a commonly misdiagnosed condition. We talked a lot about telogen effluvium and the myths and the Headington 5 categories of telogen effluvium. About 30 years ago, Dr. Headington published a wonderful approach to thinking about hair shedding. We talked in the block about chronic idiopathic telogen effluvium, a commonly misdiagnosed condition. We had some wonderful cases in all the mimickers of telogen effluvium. We talked about syphilis. We talked about ulcerative colitis and Crohn's disease. We talked about eating disorders. We talked about medication-induced telogen effluvium. Really a wonderful overview of telogen effluvium. And then we moved on to alopecia areata, talking about an approach to alopecia areata in children and adults. First, we talked about the pathogenesis, Th1 and Th2 mechanisms. What are these? What is loss of immune privilege? What does this term mean? We talked about trichoscopy of alopecia areata. We talked about the variants of alopecia areata. What is alopecia areata incognita? What is the acute, diffuse, and total alopecia of the female scalp? What is Sisyaphu? What are these variants of alopecia areata? We talked about the treatment in children, the treatment in adults, according to the SALT score. What is the SALT score and how do we use this to guide our treatment approaches? We talked about topical steroids, steroid injections, JAK inhibitors, methotrexate, DPCP, anthralin, and developed a solid approach to alopecia areata of the beard and the eyebrows and the eyelashes, and spent an entire week talking about an approach to eyebrow and eyelash loss. So it's been a wonderful 23 weeks of Block 2 as we talk about androgenetic hair loss, alopecia areata, and telogen effluvium. And our fellows are completing their Block 2 exam, a 3 to 5 hour examination which really tests their skills, and we're wrapping that up this week. And I'm so proud of the accomplishments of these hair loss specialists in 48 short weeks. It's really incredible to see the development of critical thinking skills in the field of hair loss, and we're heading into 2025 with half the program completed. And I'll look forward to updating you again as we complete the program in the summer of 2025. We're opening applications soon for the 2026-2027 EBHF, and I'll look forward to working with another group coming next year. But for now, this is an update, and I'll look forward to updating you again on this wonderful group of 2024-2025 EBHF participants that are working through a pretty challenging program. And thanks so much for your interest, and I'll update you again.